Hello everyone. So today's discussion is all about the arm, the compact region packed with powerful muscles, important nerves, and the major vessels. So today we're going to simplify its anatomy, highlighting important relationships and make sure you walk away with a solid understanding that you can easily recall during the exams and the clinical rotations. So if you enjoy clear, student-friendly anatomy content, don't forget to subscribe and join our growing learning community. So guys, catch you in a minute. So I will start with the muscles of the arm, and then and then you will see the nerves and the important nerves and the major vessels. Alright, so the muscles of the arm is also known as the brachium. The brachium is a scientific name for the arm. So the muscles of the arm are divided into compartments. You have the anterior compartment, which is also known as the flexor compartment, because these muscles, apart from being anterior, they are doing the flexion of the forearm at the elbow joint. And then we have a group of muscles which we call them the extensor compartment. This is the posterior compartment of the arm. The posterior compartment of the arm. But these muscles, they are extending the forearm at the elbow joint, so they deserve to be called the extensor compartment. Alright, so the anterior compartment, or the flexor compartment, we have got okay, so we start with posterior compartment, which will have the triceps brachii as well as anconeus, and then on anterior compartment we have the biceps brachii, we have the coracobrachialis and the brachialis muscle. So 3 muscles on anterior compartment, 2 muscles on posterior compartment. So we discuss each muscle in turn. So we're starting with the biceps brachii. And what did I say about the discussion of muscles? What are the four major important things to talk about muscles? Origin, insertion, innervation, and action. So we're starting with origin. So the biceps brachii, biceps means 2, brachii means arm. So this is the muscle of the arm that has got 2 heads of origin. So it has got 2 heads of origin, and these are the heads of the biceps brachii muscle. So we have the long head of the biceps brachii and the short head of the biceps brachii. So when I'm discussing about the origin of the biceps brachii, I should highlight the 2 origin for these muscles. Okay, for this muscle. All right, so the long head of the biceps brachii is coming from the supraglenoid tubercle. I think you remember the supraglenoid tubercle. And then the short head of the biceps brachii is coming from the coracoid process of the scapula. Guys, do you remember the difference between the coracoid process and the acromion process? Which one is higher than the other? Alright, so that's the origin of the biceps brachii. And then the biceps brachii is special because it has got 2 insertions. So we have two heads of origin, and then these 2 heads of origin, they come to form the belly of the muscle. The belly, like they are forming one muscle, like with a belly. Okay, this is the muscle. And then this muscle is going to insert to the bones of the forearm, because remember, the action of these muscles are to the forearm. Okay, to the forearm. All right, so the biceps now, it has got 2 points of insertion as well. So first of all, it forms the biceps, it forms like a tendon, and then the biceps tendon is like broadening to form a sheet-like connective tissue, something like a fascia. We call it the bicipital aponeurosis, and then the bicipital aponeurosis, it blends with the deep fascia of the forearm. So it's like it joins the deep fascia of the forearm, and then that's how it inserts. So the bicipital aponeurosis does not insert into the bone. Alright, and then we have another tendon now, the tendon of the biceps brachii now, which goes to the bone. So it goes to insert the radial tuberosity of the radial nerve, of the radial bone. So we talk about the radial bone sometimes later, but it inserts on the radial tuberosity of the radial bone. Okay. So what about innervation? I'll tell you that all the muscles of the anterior compartment are supplied by a musculocutaneous nerve. So the musculocutaneous nerve supplies all the muscles of the anterior compartment of the arm. So you remember that the musculocutaneous nerve is a continuation. It's like coming from the lateral cord. Don't worry about it. Okay, so what are the actions of the biceps brachii? So number one is the flexion of the forearm at the elbow joint. Flexion of the forearm at the elbow joint. And then the biceps brachii is a powerful supinator. So it's a powerful supinator, especially when the elbow is flexed at 90 degrees. So if you're flexing the elbow at 90 degrees, the biceps brachii is the powerful supinator. What is the supination like? Supination is like when you are trying to open the door handle. So when you are rotating the door handle clockwise, that is the supination. Okay, so if you try to flex your elbow joint to assume 90 degrees and then you hold your biceps brachii, if you are doing supination, you will feel like the biceps brachii is moving. So you feel like biceps brachii is moving. But if you're extending the elbow joint and then you are doing supination, you don't feel much movement of the biceps brachii. This is to say that its main action on the supination is when the elbow is flexed at 90 degrees. So that is supination. And then it also, because this now it crosses two joints. You see, it crosses the shoulder joint and the elbow joint. So it also has an action on the shoulder joint, which is a flexion of the shoulder joint. It's like to bring the arm anteriorly. You remember the movements of the humerus. And then the second muscle, the coracobrachialis muscle. The coracobrachialis, I think you can hear from the name. This muscle is coming from the coracoid process to the brachium, to the arm. So what is the origin of this muscle? Is from the coracoid process of the scapula. Okay, what is the insertion of this muscle? Is inserting the brachium, but which part of the brachium, to be precise, is the middle third of the brachium, but on the medial surface. So the medial surface of the middle part of the humerus. So the medial surface of the middle third of the humerus. This is where the coracobrachialis muscle inserts. So this is the coracobrachialis. Is coming from the coracoid process of the scapula and inserting on the medial surface of the middle third of the humerus. The middle side of it. So what do you think the innervation of this muscle would be? We have said all the muscles of the arm, all the muscles of the anterior compartment are being supplied by the musculocutaneous nerve. And what is the action of this muscle? So this muscle is coming from it spans only one joint, so it's coming from the coracoid to insert the humerus. So the action will be on the humerus, and so it helps in flexion and adduct the shoulder joint, not the elbow joint, because this muscle doesn't go to the elbow, so it inserts on the on the humerus. So also of its action, we said when the muscle contracts, it pulls the insertion towards the origin. So the insertion of this muscle is the humerus, and then the humerus is pulled towards the scapula, and so it produces So it produces two movements, as we said, because it's inserting through an angle. So the first movement will be, pulling this arm closer to the body, and that is adduction, and then it pulls these muscles this bone anteriorly to form a flexion of the shoulder joint. But also it adds into strength of the shoulder joint, the stability of the shoulder joint. So the last muscle in anterior compartment is the brachialis. So the brachialis could be considered the muscle of the arm proper, because this muscle is coming from the arm. So the brachialis muscle. So this is the brachialis muscle. The brachialis muscle is coming from the anterior surface of the distal third of the humerus, so distal half of the humerus. So it's coming from the anterior surface of the distal half of the humerus, and this muscle is inserting, so it's inserting on this surface of the ulnar. This surface of the ulnar is not the coronoid process of the ulnar. Remember, we have the coronoid process, and then we have the coronoid fossa somewhere there, somewhere here we have the coronoid fossa. Okay, so you see this muscle is actually special in terms of innervation, because this muscle, it has a dual innervation. It has a double innervation. The first innervation, because it's a muscle of anterior compartment, so it's been supplied by the musculocutaneous nerve, and then it has got another like extra innervation from the radial nerve. The radial nerve. Ideally, the radial nerve would supply the muscles of the posterior compartment, but it also gives innervation to the brachialis muscle. So what about the action of this muscle? It is friction of the arm in all positions. Sometimes considered the powerful friction flexor of the arm. Okay, guys, we are done with the anterior compartment. Now we are moving to the posterior compartment. We have seen 3 muscles, so we are going to 2 muscles, which will be easy, right? Okay, so we are starting with the triceps brachii. So brachii means this muscle is the brachium. It is of brachium, but triceps means this muscle has 3 heads of origin. It has got 3 heads of origin. What are these heads? We have the long head of the biceps brachii, of the triceps brachii, and then we have the lateral head of the triceps brachii, the long head of the triceps brachii, the lateral head of the triceps brachii, and then if you catch flap the lateral head, you will see the middle head of the biceps, the medial head of the triceps brachii, the medial head of the biceps of the triceps brachii. Sorry, keep saying biceps, but I mean triceps. Okay, so it has got 3 heads of origin, and then so it has got 3 origins. So if I'm asking you in exam, what is the origin of the triceps muscle, triceps brachii, you should always mention the 3 origins, because it has got 3 heads of origin. And on the we discussed about the biceps brachii, you should say brachii. If you don't say brachii, it means you are confusing your examiner, because you have another biceps somewhere, the biceps femoris. So if you don't say biceps brachii, that is not complete. So you might get yourself into trouble if you don't complete. So you say the biceps brachii because brachium, the muscle of the brachium. This is a triceps brachii because this is the muscle of the arm. So that goes 3 heads of origin. The long head of the triceps brachii is coming from the infraguinate tubercles. Remember, the long head of the biceps brachii was coming from the supraguinate tubercle. I think that you wrote that one. And then the long head of the triceps brachii is coming from the infraguinate tubercle. Okay, and then the lateral head is coming from the shaft of the humerus, just above the spiral groove. So we have the spiral groove here. You remember what a spiral groove is? It's also known as the radial groove. And so the lateral head is originating just superior, so on the posterior surface of the humerus, just above the radial groove. And then the middle head now is easier. The middle head is originating on the posterior surface of the humerus, just below the lateral groove, groove. So these 3 muscles, they form these 3 heads, they form a single muscle, which is known the triceps brachii. And then this muscle has got one common tendon. This is a tendon, and then this tendon comes to insert on the olecranon process of the ulnar. So the olecranon, the posterior surface of the olecranon end of the ulnar, yes, and fascia of the forearm. Okay, so what is the innervation? What is the nerve supply to the triceps brachii? We said all the muscles of the posterior compartment are being supplied by the radial nerve. Okay, so the radial nerve is the nerve that supplies the triceps brachii. What about the action? We say this is the extensor compartment. So I wonder if someone doesn't mention extension. Okay, so the chief extensor of the elbow, the chief extensor of the elbow, of the arm at the elbow joint, but also the long head stabilizes the shoulder joint, especially during abduction, during the adduction. So it stabilizes to avoid the dislocation. All right, so we have a small muscle in the posterior compartment, the extensor compartment, which is known as anconeus. So the word anconeus comes from Greek word enkoni or ankoni, which means elbow. So this one is actually could be considered the muscle of the elbow. It's just a muscle for the elbow. This one is very like small, piccola. It's small. Okay, so this muscle is coming from the the lateral epicondyle of the humerus, and then it's going to insert on the surface of the ear, somewhere just below the insertion of the triceps brachii muscle. So what's the innervation, what's the nerve supply of the anconeus? So all the muscles of the posterior compartment are being supplied by the radial nerve, and so this is no different. So what about the action? Number one, this is the extensor compartment. So this muscle adds to the extension of the elbow joint, but it also may abduct the ulnar during pronation. So, but also because the muscle anconeus means the muscle of the elbow joint, it also helps to stabilize the shoulder joint. It helps to stabilize the shoulder joints. So guys, we have something that is known as the brachial fascia and the intermuscular septum. The brachial fascia is the deep fascia of the arm. Brachial arm fascia. It's a connective tissue. Okay, so this is the connective tissue that surrounds all the muscles of the arm. And then we have some extension, something like an extension of this fascia that goes deep to the bone. So these, we call them the intermuscular septum, the intermuscular septum, because they are going deep into the bones. So they are dividing muscles into different compartments. So in fact, in the muscle we have different compartments, and these compartments are being contributed by this intermuscular septum. For example, this one is called the lateral intermuscular septum, and this one the medial intermuscular septum. So together, the lateral intermuscular septum, the medial intermuscular septum, they are dividing the arm into two compartments, the anterior compartment and the posterior compartment, but depending on which level you are cutting. So sometimes they have like little bit of like variations, and it's not like some of the muscles, for example, the coracobrachialis is not found in the distal surface of the humerus, and so we have some variations, and don't mind. Okay, yeah, so this is the biceps brachii, this one is the brachialis. I know this is the posterior compartment. These are just the heads of the different heads of the humerus, of the triceps brachii. All right guys, so we are done with the muscles of the arm. Let's now discuss about the muscular spaces. So when the muscles are going to different portions, to different parts of the bones, they sometimes may leave like gaps, so like the spaces, and these spaces we call them the muscular spaces. Okay, so we have mainly three spaces, but these spaces we divide them into two groups. So we have the triangular muscular groups, triangular muscular spaces, and then we have the quadrangular muscular space. The triangular because they have the shape of the triangle, so the shape is triangle, and the quadrangular because it is four-sided, right? There's four sides, like four walls. Okay, so on the triangle, we have the triangular scapular space and triangular humeral space, and then we have the quadrangular space. So we are starting with the triangular scapular space. The triangular scapular space. So guys, from the name, this space is triangular, but is found in the scapula. This is definitely what it means. Okay, it is the triangular space. It is the space, the three-sided space which is found in the scapula. So it's actually small. Don't expect something very big. No, this one is actually what we consider the triangular scapular space. So the triangular scapular space has been bordered. We have already discussed the muscles of the shoulder region. So I know, guys, you remember that this is the teres minor muscle. This one is the teres major, and this one we've just discussed it. This is the long head of the triceps brachii. So these are the ones that form the boundaries or the borders of the triangular scapular spaces, scapular space. So on above, the superior border is made up of the teres minor muscle. But if you want to be precise, of course, you can just say the teres minor muscle. But you can also say the lower border of the teres minor muscle is more precise. And then the inferior border is made up of the teres major muscle. Again, if you want to be precise, you can say the superior border of the teres major muscle should be fine. And the lateral border is made up by the long head of the triceps brachii. If you want to be precise, you can say the medial border of the long head of the biceps brachii. Don't worry, that's that's how we describe the boundaries of this triangular space. So what about the contents? The contents of the these spaces are what we more important than the boundaries, in my opinion. I mean, you should know the boundaries, but you should also know what are passing through, what are going through these spaces. So the contents of the triangular humeral space, triangular scapular space, is the circumflex, scapular artery and vein. And what do you think this artery is coming from? Where do you think it is coming from? We have seen the subscapular artery given two branches, the circumflex scapular artery and the lateral. Yeah. All right, guys. And the thoracodorsal, sorry, the circumflex scapular artery and the thoracodorsal. Remember the discussion on the axillary artery, the last part of the axillary artery. All right, guys. We are going to the second space, which is triangular humeral space. Triangular humeral space. So this space is triangular in shape, but is found on the humerus. This is triangular in shape, but is found in the humerus. Okay, so this one here, this one here is the triangular humeral space. So what are the boundaries of the triangular humeral space? The superior boundary is made up of the teres major muscle. The lateral boundary is made up by the medial surface of the humerus, and then the medial border is made up of the lateral border border of the teres of the long head of the triceps brachii. So these are the boundaries of the triangular humeral space. And then what are the contents of the triangular humeral space is what is more important, okay, which is so the contents of the triangular humeral space are the contents that are going to pass through the radial groove or the spiral groove. Okay, so what are these? These are the the radial nerve and the profunda brachii, artery and vein. So what is the meaning of profunda? It's the deep, and profunda means deep. So this is the deep artery. It's a deep artery of the arm. So the profunda brachii artery or the profunda brachii artery. Okay, guys, we are going to the last space, and this space is known as the quadrangular space. It is known as the quadrangular space because this space is four-sided. It's four-sided. So this actually here, this right over here, is what is considered the quadrangular space. So what are the boundaries of the quadrangular space? The superior boundaries by the teres minor muscle, the inferior boundaries by teres major muscle, the medial boundary is by the long head of the triceps brachii, and then the lateral boundary is by the the medial surface of the humerus. So that should be easy. I mean, if you remember, it should be easy. Okay, and then what about the contents? What about the contents of the quadrangular space? Okay, the content of the quadrangular space will actually have a nerve, an artery, and a vein, of course. But remember, we have two arteries of the humerus that just winding the surgical neck of the humerus. But the one is going through posterior, and the other one is going through anterior root. But the posterior one, the posterior circumflex humeral artery and the axillary nerve. So the axillary nerve and the posterior circumflex humeral artery. Remember, the posterior circumflex humeral artery is coming from the third part of the axillary axillary artery. Okay, so the axillary nerve is also passing the surgical, is winding the surgical neck of the humerus to go to supply the teres minor muscle. If you remember, the teres minor muscle and the deltoid muscle, we discussed this nerve somewhere else. Okay guys, so we are done with the muscular spaces, and we have sometimes you may use sometimes I like to use this one. I don't know if you can how can I make it? Yeah, so I use sometimes when I want to remember about the spaces, I am putting my fingers in this direction. So in this way you can see they assume like the shape, they assume the boundaries of all the spaces. So if you pay much attention, you see we have the quadrangular space in the middle, and then on the inferior surface we have the triangular humeral space, and then on this side we have the triangular scapular space. Put your fingers in this way, so you might be able to remember all the boundaries of these spaces at glance. So we have the triangular space at this point here, the humerus and the long head of the triceps brachii, the teres major, and then the quadrangular space, the humerus, the long head, the teres major, the teres minor, and then the scapula, the triangular scapular space, the teres major, minor, the teres major, and the long head of the triceps brachii. All right, guys, let's now discuss about the nerves of the important nerves of the arm. Number one is musculocutaneous nerve. The musculocutaneous nerve is coming at a branch of from the posterior cord of the brachial plexus, and it supplies all the muscles of the anterior compartment, and then somewhere around here it changes the name to become the cutaneous nerve. Remember, this nerve is known as the musculocutaneous. So it gives muscular component, and the cutaneous means the skin sensation. So it supplies the sense, gives this sensory information to the skin. But which side of the skin? This one over here, which is lateral side of the forearm. So this nerve is also known as the lateral antebrachial cutaneous nerve. Antebrachial means the forearm. Ante means fore, and then brachium, the arm. So this is the forearm. So the lateral cutaneous nerve of the forearm of the lateral antebrachial cutaneous nerve. As we have said, it supplies all the muscles of the anterior compartment, and then it terminates to form this cutaneous branch that's going to supply that skin. Alright, so if you have injury to the musculocutaneous nerve, means we'll have like difficulties with friction at the elbow joint, because all the muscles of the flexes of the elbow joint are on the anterior compartment. But remember that the biceps brachii is the chief supinator. So we have great loss in terms of supination. Okay, and then we are going to the second nerve, which is the radial nerve. The radial nerve is coming at the one of the the continuation of the posterior cord of the brachial plexus. Remember the discussion of the brachial plexus. And then this muscle goes through the triangular humeral space, and then it goes on the posterior surface. It runs in the radial groove, supplies all the muscles of the posterior compartment, both of the arm and the forearm, and of course it terminates by forming some other cutaneous nerve that you shall see sometimes later. But this nerve here is passing through the spiral groove, the radial groove, together with the profunda brachii artery, together with the deep artery of the arm. Okay, so it supplies all the muscles, the triceps heads, the anconeus, and some other muscles. So don't forget that it also supplies the brachialis muscle, which is the anterior compartment, which has got dual nerve supply, dual innervation. So what happens if you have injured the radial nerve? Well, that one depends. If you have the injured the radial nerve above, so above the spiral groove somewhere here, maybe the proximal part of the proximal part of the humerus, or before the origin of this triceps brachii muscle, so we have like a completely paralysis of both the extensors of the arm, the posterior compartment of the arm, and the posterior compartment of the forearm. Okay, so we have like completely loss. But guess what? This muscle is also supplying the brachialis muscle. So that component. So the brachialis muscle will not be like completely paralyzed because it has got another innervation from the musculocutaneous nerve. So it will be spared. So we have like just a weakness of the brachialis, but not completely paralysis. But what happens if we have injury around the radial groove? Okay, if we have the injury around the radial groove, the triceps brachii muscle is not like completely paralyzed. Okay, it is just like weakened, and so the extension is not lost. If the extension is not lost, means we have some few extension. Why do you have few extension? Because the radial groove is somewhere here. So the radial groove, the spiral groove is somewhere around here. So if we have damage, you see the lateral head is already being supplied. The medial head is already, or part of the medial head is already being supplied, and the lateral head, you can see, is already being supplied. So see, we have the long head is already being supplied, the lateral head is already being supplied, but a small part of the medial head is already being supplied, and so the lower part of the medial head is not yet to be supplied. So what will be lost is that lower part of the medial head of the biceps brachii, of the triceps brachii, that will result into weakness. So we have like weakness in extension, but the extension is not completely lost. So that's extension. But what happens, because anything dies to the radial groove, will be paralyzed, okay, except for this paired some spared. So we consider these parts which are not like affected to be spared, so to be left unaffected, to be spared. But anything below will be paralyzed, including the muscles, the extensors of the wrist, So a patient will present with a wrist drop. Wrist drop is very, very important clinically. Maybe we talk about the wrist drop again when we're discussing the muscles of the forearm. But at this point, you should know that someone with damage to the radial nerve will present with the wrist drop, so dropping of the wrist. Okay, why dropping of the wrist? Because it's because the extensor compartment of the forearm is gone due to the injury of the radial nerve. Alright guys, we have like some few clinical correlates. Number one is the biceps tendon. So the biceps tendon is just like it tests you are hitting the biceps, the tendon of the biceps brachii, the biceps tendon reflex. You are hitting the tendon of the biceps brachii, so as to check for the integrity of the muscles of the nerve that was supplying this muscle. But to be precise, we are checking to the deep into the nerve roots. So we are checking the nerve roots C5, C6, C7, but mainly C5 component of the musculocutaneous. So if you have like when you are hitting, you press your thumb just on top. The arm is a little bit flexed, the forearm is a little bit flexed at the elbow joint, and then you place your thumb on top, and then you hit with this hammer. So you tap a bit, and then this arm should like flex a bit, so like you see this reflex. So if this is not happening correctly, so we know we have like something wrong with the C5 spinal root, stage 5 spinal root. All right, so we have the fracture of the humerus. The fracture of the humerus, they have like different clinical presentation, as we've just seen, because the surgical neck of the humerus, the radial groove is where the radial nerve passes by. So if you have the damage of the radial nerve, to get damage of the spiral groove, like fracture along the spiral groove, the profound brachial artery will be affected, but as well as the radial nerve. So how does the radial nerve presents? With the wristy drop. Okay, but we know also we can have the fracture along the medial epicondyle of the humerus, and I told you just behind the medial epicondyle of the humerus passes the ulnar nerve, the funny bony. Okay, yeah. So you see what happens when you have damage of the the ulnar nerve. Okay, let's now discuss about the brachial, the vasculatures of the forearm, of the arm. The brachial artery and the veins. Okay, so the brachial artery is the continuation. It is a continuation of it is a continuation of the axillary artery. Just below the lower border of the teres major muscle, the axillary artery becomes to be the brachial artery. So it's just a continuation, direct continuation of the axillary artery. At which level? The lower margin of the teres major muscles. As soon as the brachial artery is formed, it gives a deep branch. This deep branch is known as the profound brachial artery. Okay, this profound brachial goes, it winds around, and it goes back. And where does it go? In the spiral groove, together with which nerve? This is the profound brachial. So it's formed from anterior and goes on posterior, together with the radial nerve, to go in the radial groove. So we have fracture of the radial groove. We are damaged to important structures. The first one will be the radial nerve, and the second one will be the deep artery of the arm, which is known as the profound brachial. The profound means deep. Okay, and then some other branches. The profound brachial is also given, like the radial collateral artery and the medial collateral artery. The radial and the medial collateral artery, together with some other branches. And then what are the other branches that are coming from the brachial artery? We'll have the superior ulnar collateral artery, which is going this direction, and on this distal portion of the brachial artery, we'll have the superior ulnar collateral. Yes. So we have also, so the biceps, okay, sorry, this is inferior. This is inferior ulnar collateral artery. So the brachial artery terminates by forming two terminal branches, and the one will be the radial artery, and the other one will be the ulnar artery. And so we see also these arteries whenever we discuss the cubital fossa, the cubital fossa. All right, guys. Now these are the branches of the of the brachial artery. Let's now talk about the clinical correlates. So guys, you see this is the bicipital tendon, the bicipital aponeurosis. And so when you want to check the blood pressure, so you are finding somewhere to put the stethoscope so as to listen to the beating of the of the heart through these vessels. So the first thing that you do, you palpate for you palpate, like you flex the arm and you palpate for this bicipital aponeurosis, and then after you feel the bicipital aponeurosis, you go a little bit medial on the medial side so as to find the brachial artery. Okay, so the brachial artery is the medial to the tendon, to the bicipital aponeurosis. So if you want to place your stethoscope, you should first of all feel the bicipital aponeurosis and then go a little bit medially to find the brachial artery, so that you can listen to your heart sounds. So we have the two important veins, like maybe three important veins of the arm, but we have the basilic vein and the cephalic vein. Okay, so the basilic vein is coming as the medial continuation of the dorsopalmar arc. this one. So this is the basilic, this is posterior. So this is the medial continuation of the dorsopalmar arc. So this one is going in this direction, and then this is what I'm talking about. So it goes in this direction, and then it joins the brachial vein to form the axillary vein. So the brachial vein and the basilic vein, they join together, they form the the axillary vein. And then we have the cephalic vein. The cephalic vein is coming as the medial continuation of the dorsovenous arc, and then it goes along the deltopectoral groove, and then it drains to the axillary vein as well. And then we have the median cubital vein. The median cubital vein is also clinically important because here is where you are drawing blood. So if someone wants to draw blood from your cubital fossa, the main targeted vein is always like the median cubital vein, but we have a lot of anatomical variation of the median cubital vein. Okay, guys, if you haven't subscribed, means you are missing a very important opportunity to be notified once we release clear